Interviewing is a purposeful and systematic communication process used by nurses to gather essential information and build a therapeutic relationship with the client. Interview is a tool to establish the nurse client relationship. Interviewing allows us nurses to form a trusting relationship with our client at the start of care. For example, introducing ourselves properly and explaining the purpose of the interview helps the client feel comfortable and respected. We use interviewing to obtain subjective data about our client's health status. Through this mode, we collect information directly from the client about symptoms, feelings, and health concerns. An example is asking our client to describe pain, dizziness, or fatigue in their own words. It is through interviewing that we are able to identify the strengths and risk factors our client has. Interviewing helps us uncover health promoting behavior as well as health risks. For instance, a client may report regular exercise as a strength or smoking as a risk factor. The interview will soon guide the physical examination. Information obtained during our interview will direct us on which body system or systems require focused assessment. A client reporting shortness of breath guides the nurse to prioritize respiratory examination. Establishing a nurse client relationship creates a foundation of trust that supports effective communication and care. The nurse client relationship enables us to build trust, rapport, and openness. A respectful and attentive interaction helps our client feel safe to communicate honestly. For example, maintaining eye contact and listening without interruption encourages openness. This also demonstrates empathy and respect. As we encourage our client to share sensitive or complex information, trust need to be present. Empathy and respect are also shown through understanding responses and a non judgmental attitude. For example, acknowledging a client's fear about a diagnosis shows concern and professionalism. As our client is encouraged to share sensitive or complex information, we enable them to willingly discuss personal concerns. Our client may feel comfortable sharing emotional stress or lifestyle habits during a supportive interview. We also facilitate client comfort and cooperation. A positive relationship through the nurse client relationship makes our clients more relaxed and willing to participate in assessment and other healthcare activities. A client who is calm and comfortable is more cooperative during procedures. The nurse client relationship forms the basis for ongoing therapeutic communication throughout our client's care. This initial relationship supports continued communication beyond the interview. This allows us and our client to communicate effectively during future interactions. Obtaining subjective data focuses on gathering information that reflects our client's personal experience of health and illness. Obtaining subjective data means gathering data directly from the client's perceptions, experiences, and symptoms. These subjective data come from what the client reports feeling or experiencing. An example is our client describing emotional distress or describing the severity of pain experienced. Subjective data also provide information that cannot be obtained through objective techniques alone. Some information, such as pain intensity or anxiety, cannot be measured by equipment. The nurse must rely on the client's description. These data helps us identify the history of present health concern, review of systems, and lifestyle and health practices. Our clients' responses contribute to understanding the current problem, the review of systems, and daily habits. By asking about our clients' diet or sleep patterns, provides useful health information. Subjective data guides the nurse in identifying patterns related to health or illness. By listening to repeated symptoms or behaviors, we can now recognize patterns. Example, frequent headaches are associated with stress and may indicate a health pattern. Identifying the strengths and risk factors supports individualized and preventive nursing care. This reveals protective factors, coping abilities, and health promoting behaviors. Clients may report behaviors that support health, such as regular exercise or strong family support. These also help determine risk factors such as lifestyle habits, environment, or family history. Interviewing reveals risk like smoking, poor diet, or family history of illness. It is through the interview that we are able to identify areas of potential concern early in the assessment. This allows us to identify early on any concern that will enable us for prompt nursing action, such as early reports of dizziness, which should alert us for possible safety concerns, specifically risk for fall. The information we gathered through interview supports individualized health teaching and preventive care, allowing us to tailor our health education plan. We may provide, for example, smoking cessation teaching based on identified risks. The interview data play a key role in planning and conducting an effective physical examination. The interview directs the nurse toward specific body systems or areas requiring further assessment. A client complaining to the nurse on areas such as pain or anxiety will allow the nurse to focus on these areas. The interview also helps prioritize the sequence of physical examination. The data we gather during interview allows us to identify urgent concerns that needs to be assessed first. For example, a client who complains of chest pain, that would mean that it would take priority over routine checkups. Data gathered during the interview allows anticipation of the equipment or techniques needed. Knowing our client's concern helps us prepare necessary tools such as blood pressure or stethoscope. The data from the interview allows us a focused, efficient, and safe examination process. A guided examination prevents unnecessary procedures and promotes client safety. An effective interview is defined by communication skills and professional behaviors that promote accurate data collection. An effective interview needs therapeutic communication. This encourages understanding and expression. Using open body language and attentive listening supports this process. Professionalism and courtesy. These are behavior that are very important when conducting an interview and to ensure that the interview is effective. Our professional behavior and polite interaction creates a respectful environment. Proper greetings and respectful tone demonstrates courtesy. We also ensure privacy and confidentiality. Protecting our clients' privacy ensures that sensitive information is shared safely. Conducting interviews in private areas supports confidentiality. Sensitivity to culture and developmental level is also an important characteristic of an effective interview. We need to have an understanding of our clients' cultural beliefs and knowledge on the developmental needs to ensure that we provide respectful communication. Adjusting our language for children or older adults is a classic example. Therapeutic communication supports effective exchange of information between you, the nurse, and your client. Therapeutic communication uses verbal and nonverbal communication to encourage expression and understanding. Words, facial expressions, and gestures help clients express themselves. Nodding while listening encourages continued sharing. Therapeutic communication also involves active listening, empathy, and appropriate questioning techniques. Listening to our client attentively and asking clear questions help gather accurate data. Empathy reassures clients that we are there to listen and understand them during discussion. Therapeutic communication helps clients feel heard, valued, and understood. When our clients feel understood, they are more open and cooperative. Therapeutic communication also strengthens rapport and improves clarity of subjective data. Clear communication improves the accuracy of information shared during assessment. Professional conduct during interviewing supports ethical and effective nursing practice. Professional demeanor fosters trust and respect. A calm and confident behavior helps our clients trust us as their nurse. Courtesy includes proper introductions, attentive postures, and respectful tone. Simple actions such as introducing oneself and speaking politely show respect. Ensuring privacy and confidentiality protects client dignity and adheres to legal and ethical standards. This means safeguarding information. This maintains client dignity and trust. Clients disclose more accurate information when they feel secure. Feeling secure encourages honesty, which improves assessment quality. Sensitivity to culture and development ensures respectful and individualized care. Cultural sensitivity considers cultural beliefs, values, communication patterns, and health practices. Understanding cultural practices helps avoid misunderstanding, such as beliefs about traditional remedies. We also need to adapt our interviewing techniques to match our client's age, cognitive level, and developmental stage. Language and approach should suit the client's level, such as using simple terms when talking to children. Avoid assumptions, stereotypes, and culturally insensitive language. Avoiding bias prevents miscommunication and disrespect. ensures respectful, individualized, and equitable care. When our interview is culturally sensitive and focuses or take in consideration our client's developmental level, we are able to provide respect to our client's current culture and also interact with them in the way that they can understand. This allows us to provide care catered to our clients' unique needs. Interviewing is a systematic communication process that allows the nurse to build a therapeutic relationship, gather accurate subjective data, and identify strengths and risk factors affecting health. When done with professionalism, therapeutic communication, and cultural sensitivity, interviewing guides a focused physical examination and supports safe, individualized, and patient centered nursing care.